Many thanks for staying with us here on News Desk here on your Joy News channel on Multi TV. To some more stories now, and the Health Insurance Service Providers Association of Ghana, HISPAG, has served notice it will suspend services to patients across the country if the National Health Insurance Authority fails to pay monies due its members. Now, HISPAG says all payments to their members have been suspended pending the conclusion of a probe by the Bureau of National Investigation into NHIA activities. Now, the BNI has been investigating cases of fraudulent payment to some health institutions and recently froze the accounts of former CEO Sylvester Mensah. Frank Toblu is the Executive Director of the Health Insurance Service Providers Association of Ghana, HISPAG, and he joins us over the telephone lines now with a lot more on this. Mr. Toblu, good morning. Many thanks for your time here on News Desk.
Yeah, good morning.
So what really are your concerns? That you are owed some monies and you expect the NHIA to pay?
Yes, as I speak to you now, there is a huge level of indebtedness of the National Health Insurance scheme to the providers nationwide. But 2 weeks ago, we've had an information that they were making very frantic efforts to make payment to us. Then in another development, we had another information indicating to us that payments were suspended until the ongoing investigation by the BNI is complete.
Who gave you that information?
That is the providers, because they have been trooping the offices of the health insurance scheme at the district level. And when they went there, in the first time they were told, oh, there is some funds available, and they were making ready documents to enable them pay them. Then in another development, they were told they were asked to hold on until further notice, following from the investigation going on. So we are very much concerned about the situations on the ground. In as much as we welcome the investigation, it's a very healthy one. We cannot downplay that one, because like I said earlier, we are the ultimate beneficiaries. If the funds of the National Health Insurance Scheme is well guided, protected, it will definitely be given to the providers, because we are the ultimate receivers. So therefore, it's not a problem to us. But the difficulty we have is that under no circumstance should payment be suspended to us, irrespective of the fact that investigation is going on. We should also be receiving money alongside, because we also continue to provide services to the people of this country under the National Health Insurance.
Mr. Toblu, you'd have to hold on briefly for me, and let me try and get something clear here. So you are saying that the NHIA wrote to you officially and gave you reasons why you couldn't pay your monies at this particular time. Is that what you're saying?
Say it again.
Are you saying that the National Health Insurance Authority wrote to you citing reasons why they couldn't pay your members these monies due them at this particular time? Is that the case?
They are not written officially. Okay. They are not written.
So again, I ask, are you basing all your allegations on hearsay that some of your members say they have been to the offices of the NHIA and they are told that this is it, their monies cannot be paid because...
That is it. That is it. You see, hardly will you get written information from National Health Insurance. I must confess that hardly, because even if sometimes you write to them asking for some information, you end up not getting it at all. So sometimes when you go, they tell you, oh, this is it. Everybody in the health insurance office is like scared to give up information. They are all scared in the office there to give up information. So they only say it by word of mouth that, oh, this is the situation. And then the moment they tell you, and if indeed that is not the position, why is the money not coming?
Okay, so now I need to find out. Your arrears, how many months does it go back?
Taking away December, we have 7 months to go.
So 7 months?
7 months, so, yes, taking away December.
Now, I'm trying to understand something. This wouldn't be the first time you're owed such amounts of money, and particularly for such a duration, would it?
Yes, this is not the first time.
So why raise concerns now?
Yes, you see, our concern is that we don't take delight in saying that pay us or we will not provide service or we will collect money from the people. We don't take delight in that at all. At all, we don't take delight in that. Now, what we are trying to say is that we want to establish a status quo that fine, you pay the money at every month, let us have something. This is what we are trying to establish. You see, and that is even the details of the National Health Insurance Scheme position, that every month they're supposed to pay something. Now that you owe the providers for 7 months, fine, we are suggesting that you give us at least 2 months, and then consequently give us payments every month, so that we can find a way to clear the outstanding liabilities. So if you give us 2 months now, and then subsequently you continue to give us every month something, then our liquidity position will be okay, and then we'll be able to continue to provide quality services as a strength. We are not saying, pay everything to us. You see, you just give us 2 months, and then come the next month, give us 1 more. So you will see how liquid we shall become, and then we'll find a way of settling the arrears over there.
So these are the concerns of your members.
We constantly need money.
So these are the concerns of your members. You want them to make some payments up front and then subsequently make a lot more in the course of the period.
Exactly. We want 2 months at least, if not for anything at all. We need 2 months now, and then constantly every month we need some money.
Mr. Toblu, let me ask this question now. Who are your members?
We have our members coming from the private sector, largely.
The private sector?
Largely.
And to a large extent, most of the providers from the private sector belong to CHAG and a few others. Not so many of them, we are told, belong to HISPAC.
You see, I do not want to get into that discussion. Even if it is one person who is a member, even if it is 2 people who are members, the most important thing is that whatever that is due them is given them to enable them continue providing service. Now, if one person is a member or 2 people are members, and then monies are not paid, and then they sometimes withdraw service or they don't provide what is expected, and some important personality gets there and die. Are we saying that because there are not many and money should not be given? You see, let us not be discussing issues of how many members do you have before the right thing is done. These are the things we need not to be talking about. You understand? We need not to be talking about how many members do you have. So does it mean that you need to have members before the legitimate thing is done? That is not should be the case. We don't have to be traveling on that path at all. It is irrelevant to me.
Mr. Toblu, let me ask, how do you get funding to run your outfit, HISPAC?
HISPAC is being funded by member subscription, membership dues. Members pay dues, and then we use it to run the organization.
Okay. So you do not receive funds from, say, Danida or USAID?
Unless there is a program they want us to do, and then they make funds available in that regard.
So you do receive funds from them?
Yes, we had. That was last year. We had some funding from them to do some advocacy work, which you and I know we have done. And then we are hoping that this year they will support us again, and that is what we are looking up to.
Okay. Right. Many thanks for your time. But we are told that the payments are going to be made by close of week or early next week. So I'm sure you can tell the members to stay calm, and their money will be hitting their accounts pretty soon. But that was Frank Toblu, who is the Executive Director of the Health Insurance Service Providers Association of Ghana, HISPAC, on the line there. And he joined us with a lot more perspective on this particular matter. We'll be bringing you a lot more on this. We'll bring you a lot more on this particular subject matter later on. We can move on and do some more stories on this on News Desk this morning. And please, in Tema, will today begin an autopsy. Well, an autopsy today is expected to be conducted to ascertain the exact cause of death of the head of the Environmental Protection Agency's office at Tema, 48-year-old Ebenezer Fiahagbe, who was at home with his wife, 2 children, and a house help, was shot in the left side of his chest, killing him instantly. Now, the incident, which occurred on Monday, has left many in shock, especially as a number of such killings occurred in the community last year. Joining us over the telephone lines now is the Public Relations Officer of the Environmental Protection Agency, Angelina Mensah, with a lot more. So I'm told her line has has dropped there, but we can try and speak to the police on the ground now. They have a lot more answers on this particular issue, so we can go on to the phone lines now and speak to the Public Affairs Officer of the Tema Regional Police Command, ASP Juliana Obeng, who just joined us over the telephone lines now. Madam, good morning. Many thanks for your time on News Desk.
Good morning to everyone.
So, if I may ask, what have you gathered so far in your investigations? We are hearing that preliminary investigations suggest that this was probably a contract killing.
I don't know where you're gathering your information from, but then what we have said that pre-investigations indicates that there was something stolen from the house of the late Mr. Ebenezer Siabe. As to whether it is contract killing or not, I think that further investigations will reveal. When it reveals, we would come back to the people of Ghana through your medium to establish as to whether it was contract killing or not. But for now, let us please stay away from the term.
From the speculations. I understand that.
Has not revealed that so far.
So, what have you gathered about this particular murder in the first place?
Yesterday, we mentioned that when we got to the scene, we put our men together, the experts together, to take evidence that we would need. Again, we have made an appeal to the general public, especially people living in and around New Dawenya, the area in which that incident happened, to help the police with information. We have even added that anybody who helps the police with information that will lead to the arrest of these criminals will be handsomely rewarded by the Ghana Police Service. And so as we speak, investigations are ongoing. Obviously, for murder cases, it would just not be right that we bring to bear what we have gathered so far that would disrupt investigations that are going on. And so good people of Ghana permit the Tema Police to please proceed and continue with the investigations they have started. Let us not, as it were, stumble on their way by asking some questions that would interfere with the investigation.
So does that in any way suggest that the police does not have any leads as of now?
As it is now, what we can say is that we are still on the ground, we are still investigating, we are in touch with the people that we need to be in touch with. And then again, we are making an appeal, which I have already mentioned. Right.
Many thanks for that particular update on News Desk this morning, and that was ASP Juliana Obeng. She's the public affairs officer of the Tema Regional Police. She's been telling us much more about that murder of the Tema boss of the Environmental Protection Agency. We were told he was actually shot dead yesterday. We'll be bringing you a lot more on this in subsequent bulletins. Time now for a break here on News Desk. When we come back, Emmanuel Abuajewiafe joins us with business.